Welcome to the Prepper Report. This show is the only show in the nation exclusively dedicated to emergency preparedness. And today we have an exciting show for you and an exciting guest. Our guest today is Dr. Frank Guyette, and he is an emergency physician. And he's going to talk to us a little bit about emergency preparedness when it comes to the medical issues, about kits and about specific cases that we might deal with in an emergency disaster scenario. Thank you for coming to us, Doctor, and thank you for joining us today.
Oh, thanks, Josh. It's a pleasure to be here.
So, when we talk about emergency preparedness and from a medical perspective, what is your first thought as far as the average citizen on the street? What should they know, and what can you tell them that's going to help them deal with a disaster?
Sure. So, the textbook definition of a disaster is an event where you've exceeded the resources that are available to provide care or response to a victim. And in our case, that definition varies depending on where we are and what type of situation we're in. And one of the key considerations is if we're just walking down the street and someone in front of us is harmed or falls ill, then that to us is a disaster. We have to be able to respond to that, and we may not be prepared or have the resources to deal with it. We also rely very heavily on the services that are available to us through the local government, EMS, the fire department, that type of thing. And even in the best case scenario, it will take a little bit of time to get those services to you. And while you're waiting, there are some really critical interventions that you could do to save a life.
And so, just going back to you for a minute, what is your background as far as emergency medicine is concerned?
Sure. So starting when I was a teenager, I started volunteering with ambulance services and working as an emergency medical technician. And then following college, and I started with medical training at Tulane University. Following my doctorate, I did a residency in emergency medicine and a fellowship, 2 years of additional training in EMS, which is emergency medical services or out-of-hospital medicine. So how to build better services from the standpoint of providing care with ambulance services, with fire departments, those types of things.
So you know how to deal with things on a greater scale than the average person. Obviously, a person, you just mentioned that a disaster could be defined as narrowly as the one person that collapses on the street, but obviously there are scenarios that we're going to have to deal with which are much larger and broader, things that are going to have would affect a whole family in a fire, let's say, a whole community or a whole nation. So speaking, today we're going to be speaking about hopefully a little bit about both, about the narrow definition of a disaster and the person, like I said, that just collapses on the street, as well as a more broad definition of disaster. What could you tell our listeners about the narrow definition, about somebody that collapses on the street, or what someone should have in their household or in their car or on their person to prepare for such a scenario?
Sure. So for that narrow disaster, for the person that collapses in front of you or is injured directly in front of you, probably the most critical things are simply knowledge. What to do if someone is hurt in front of you. And we can talk about a couple of cases if you don't mind.
Sure.
If we could advance to the case on Prepper for a Day, that would be great.
Okay.
Okay. So in this first case, we have a gentleman by the name of Bill, who's perhaps your neighbor, who's shoveling snow in his driveway when he collapses. As you walk up to Bill, you notice that he's not moving, that he doesn't respond if you call his name or if you shake his shoulder, and he doesn't appear to be breathing. So in this particular circumstance, Bill could have suffered a cardiac arrest. And this would obviously be something where your first intervention would be to call for help. And in functioning system, you would call 911, and EMS and resources would be dispatched to your location, to your home. But that, again, even in the best system, may take 5 to 10 minutes. And during that period of time, again, there are critical things that we can do to help your neighbor. In terms of CPR, in terms of someone who collapses, performing CPR is a critical intervention. And with the advent of automated external defibrillators, we can also prevent people from dying from abnormal heart rhythms. So it's really important, one, that we know how to do CPR, and two, we know how to use an AED or automated external defibrillator. Kind of critical to any situation is being able to summon help. And fortunately, we live in a system where, in most cases, merely dialing 911 will get us the appropriate help.
Now, again, obviously, we're dealing with a very narrow definition of disaster. There's one person who's been injured, and like you said, there's a functioning society around us. We have communications. Of course, if you were to be in a remote area where there wasn't that external help, or you were in a system that was not functioning, there would be a lot more that would be necessary to have along your side in order to deal with the situation than just the CPR or AED.
Sure.
But let's just take it back for a second, because there may be listeners out there. I'm sure everybody's heard of a CPR, everybody's heard of an AED, but not everybody may know exactly what that is or what that entails. Would you like to discuss exactly the background of what CPR is, what is an AED?
Sure. So CPR is cardiopulmonary resuscitation, and the idea is to compress the heart in order to circulate blood flow and to buy time, essentially to buy time until you can get to definitive care. And as you mentioned, that could vary quite a bit. If you're in an urban situation with a functioning EMS system, again, it's going to be relatively short, maybe 5 to 10 minutes. If you're out in the wilderness, it still may be effective. There have been cases where people have done CPR for over an hour and were still able to save a life, while resources were gotten to the patient, or the patient was taken out of that austere environment, that environment where there are no resources. Unfortunately, if it's going to be much beyond that, then and there is no functioning EMS system or functioning healthcare system, your options are pretty limited for someone whose heart's stopped.
So CPR is not a situation which you're going to be able to do this, whatever it is, and the person's just going to get up and start saying, "Oh, thank you very much, I'm fine now." There needs to be a greater level of care in addition to that CPR.
Usually, unless the reason that the person's heart is not pumping blood is because they're in an abnormal heart rhythm that could be corrected with the AED. So the AED can actually bring somebody from a point of being unconscious and not having any blood flow to the point where they're conscious and speaking to you.
Okay. So did you want to move on to, or did you want to demonstrate possibly something to do with CPR?
So probably many of your guests are familiar with CPR. They've at some point have taken a CPR course. And even though this is very basic, I want to come back to this because there have been a couple of critical changes over the last couple of years. The focus has gone away from focusing on the ABCs, or airway, breathing, circulation, to just providing high quality, good chest compressions. The breathing has been found to be less important, and also having to do mouth-to-mouth on somebody really probably discourages many people from helping, particularly when it's somebody they may not know or may not have any relationship to. The other thing that's been critically different is that over time we realized that while having very high-quality CPR training is important for some people, professional rescuers, healthcare providers, that type of thing, for the lay public, really just teaching them how to do a good basic compression can be equally effective and can buy time until resources arrive. And I would encourage anybody to go out and take a CPR course, either through a local school or a community organization. There are courses that are run by the American Heart Association and by the American Red Cross that are readily available as well. But one of the really unique and neat things that's come down the pike recently is this idea of CPR Anytime, which is a program by the American Heart Association in which you can send away for a small kit that's very inexpensive, and it has a little mannequin and a DVD to teach you how to do CPR. You mind if we
Please,
go through it?
That sounds very exciting.
So this is the little CPR Anytime kit. It's just a little cardboard box that comes with a DVD that you can watch, and the DVD goes through basic instruction. And typically a CPR course has required an expensive mannequin and very labor-intensive instruction. But these new kits use a very simplistic model, which is essentially just a little inflatable mannequin. And very quickly, you can have your whole family around the TV for one night, inflate the mannequin. And while you're watching the video in real time, you can learn how to do high-quality CPR. And so the critical components, as always, are being able to open the airway and then being able to do compressions. And it's simply learning where to position your hands, to lock your arms, and to go ahead and provide 100 compressions per minute, and to do that continuously for as long as possible until help arrives. A couple of other key factors are that fatigue is a big problem. Obviously, even a very fit person, it's difficult for them to do 200 compressions. So it's important that about every 2 minutes, so about every 200 compressions, you switch out with an available rescuer. The mannequin is designed as well to allow you to be able to do mouth-to-mouth resuscitation or rescue breathing. But that is no longer really a critical thing to do unless there's a prolonged period of time. So at least for the first 10 minutes, it's not important to do those ventilations and doing just those high-quality compressions and pumping blood for the person until help arrives is really the critical part.
So two things. First of all, obviously, you're going to call 911 or try
Right.
to get help. And then you're going to start with the CPR. What do you want to make what can go wrong with CPR? What are the biggest mistakes with CPR?
Surprisingly little. That's the beautiful part. Many people worry about the risk of injuring the person from doing the compressions, and certainly it's possible that you could break ribs or cause minor injury. But in the grand scheme of things, if you save their life, that's really unimportant. Mm-hmm. They're doing the high-quality CPR, doing the compressions, just continuously doing the compressions, about 100 per minute at a depth of 2 to 3 inches is really all that's important. And particularly for us as the lay rescuer, that's really all you need to do until help arrives. And again, at least for a brief period of time, the mouth-to-mouth resuscitation, which is a little bit more complex and also carries the concerns of having to have somewhat intimate contact with somebody, we can kind of put that to the wayside for a period of time.
So how do you know for sure that this person is unconscious?
So that's an interesting thing, is that we used to do pulse checks, and what they found is that it's very difficult for lay people to do pulse checks. So essentially now the recommendation is that you do a 10-second assessment of signs of circulation. So is that person breathing? Is that person moving? If you shake their shoulder, can you get them to respond? And if you can't, then the assumption is that they need it, and to go ahead and initiate CPR. And certainly anyone who's unresponsive, certainly should have called 911 already, or at least asked somebody to try to get help.
Now, a person that's unconscious, it could be a cardiac issue. It could be other things as well. Mm-hmm. What if the person's choking? Mm-hmm. Would that differ in any way?
If they're at the point where they're unconscious and not breathing, then it doesn't differ.
Okay.
If you see them actively choking, then obviously you're not going to throw them to the ground and do CPR. But certainly doing abdominal thrusts or what was previously called the Heimlich maneuver would be appropriate in that time. But there has to be a little bit of context to know what to do.
Okay. And as far as ages of the victim, whether it's a child or an adult, does that matter?
It does to some degree. Using this mannequin, doing this continuous CPR for 10 minutes, that is for adults. But for the purposes of CPR, an adult is somebody above 8.
Okay.
So basically, a larger child, a teenager, you would treat just as an adult.
How would you practice, or how would it be different for a child or an infant?
So for a child or an infant, it's a little bit different because the primary reason that a child or an infant has their heart stop is usually because it's an airway problem. It is more focused on keeping the airway open, on providing rescue breaths, and they still do rescue breathing interspersed with compressions. Okay. So it's a little bit different, but fortunately, cardiac arrest or a heart stopping in a child is very rare. So you're much more likely to encounter the event in an adult.
Now, does this kit actually certify you for CPR?
So no, it's not a certification, but again, for our purposes as a lay person trying to help a neighbor, this is probably a much better way to reach a larger number of people and using resources a little bit more wisely.
Now, I know that you're not obviously a legal, you're not a lawyer, so you can't give any legal advice, but I can imagine that a lay person in the street sees somebody fall down and they may worry that they're going to be sued by this person if they injure them or something. Can you speak a little bit to what are the liabilities of a person when they see somebody in that kind of situation?
Yeah, so again, I'm certainly not a legal expert, but the Good Samaritan laws do protect you to some degree to your level of training. So if you're a lay person and you did CPR and perhaps you've had some training in the past or you've used this device, that's I think that's a reasonable expectation that you've had some basic training and you're capable of doing this. If you tried to whip out a knife and do surgery on the person, then obviously that's different. You're not trained to do that, and that would be a little bit different. But there definitely, I think the intent to try to help somebody, particularly someone who has the potential to have a life-threatening event, it probably goes a long way.
Okay. Now, in public buildings all over the country now, and I understand that they've gone down in price considerably, so you see them a lot more often. You see these AED devices. What exactly is an AED, and how does it work?
Sure. So unfortunately, one of the primary reasons that someone's heart might stop is that there has been an abnormal heart rhythm, and the heart is quivering. It's beating without any organization, and because of that, it can't pump blood. Only when the heart pumps, when all the cells in the heart pump together, is it pumping blood efficiently. So if it's quivering and not pumping blood, that is caused by abnormal heart rhythms called ventricular fibrillation or ventricular tachycardia. And the treatment for that is to put essentially a jolt of electricity through the heart, which will stop it, and then allow the heart to start back up together, but in unison this time, pumping blood. So that's essentially the theory behind an AED. Mm-hmm. And they're very effective at treating those two types of abnormal heart rhythms. They also have a little computer chip in them that's pretty smart. It will only shock those two rhythms. So once the AED is placed on the patient's chest, there's no worry about accidentally shocking them because the computer won't allow you to shock something that isn't one of those dangerous heart rhythms.
Are all AEDs equal? Do they all work the same way?
There's a couple of different technologies that are out there, but for the most part, they all work the same way. They're all very safe. The manufacturers, some of them have a few more gadgets than others, but in general, they're all very safe and very simple to use.
What kind of training is necessary for it?
So typically in most CPR classes today, you'll have AED training incorporated into it, and that's really important because, again, for many people, this is the CPR will buy you time, but the AED may actually fix the problem and save that person's life. So it is very important. If you don't mind, I'll go ahead and show you. This is a training model. So this one won't shock anyone, but when you open this up, this little device comes with a set of pads that are in a foil packet, and you take the foil packet out, and fortunately, there are little diagrams that tell you where to put the pads. Typically, we want to put a pad on the basically the apex of the chest, the top of the chest, or sorry, the top of the chest and the apex of the heart, so the top and the side. But actually, in most cases, you just kind of follow the directions on the pad. You would place the pads on the patient. Again, following the little pictogram that's on the AED. There's a little cord which has a fitting that only fits into the AED one way, so there's no risk of putting it upside down. You go ahead and slide that cord into the machine, and there are usually only 3 buttons on the machine. In this case, there's an on-off button. The machine will then analyze the rhythm automatically.
Do not touch the patient.
And it takes a couple seconds to do so.
Shock advised.
And in this case, the computer thinks that this is one of those dangerous heart rhythms.
Deliver shock now. Press the orange button now.
And at this point, you would ask everybody to step away from the patient. And one good way to do that is to say, I'm clear, you're clear, we're all clear, and
Press the R shock delivered.
press the button.
Paused. Begin CPR.
Okay, and if the machine will then tell you once the shock is delivered to begin CPR. If the patient does not get a pulse back at that point, then the machine can be used again to cycle through and assess the patient.
So you just leave those on while you're doing the CPR?
Correct.
Okay.
Correct. And there's no, as long as you're not touching the patient when you hit the shock button, there's no danger of being shocked by the device itself.
Okay.
In general, obviously, because it's electricity, it's a good idea not to have the patient in a puddle or something like that. But again, a very simple device, very robust, and as you said, located in many public buildings these days. So you're generally not more than a few hundred feet from an AED.
Now, how long, assuming this patient has gone into cardiac arrest, how long does he have before these methods are used? How long can a person survive without a heartbeat?
So it's interesting. Unfortunately we start to see damage to the brain and other internal organs beginning around 4 minutes. So it is important that you respond quickly as a layperson. Because again, we spoke about even in an ideal system, EMS is going to take 5 to 10 minutes to get to the scene. So in order to maximize somebody's chances of survival, it is really important that we as lay people come to the aid of our fellow citizens.
Interesting. Now, if as a physician, and if you were to see this on the street, you would do pretty much the same thing. You'd be doing the CPR and you'd be using the AED as well. Is that correct?
Absolutely. I would. The first thing I would do is I'd yell out to anybody who was available and say, "Go call 911," and then I would begin doing CPR. And if there was an AED available, do exact.
Stop CPR.
Oops, sorry. I would do exactly the same thing.
Right. So it's not necessary to, and a lot of times you'll see somebody falls down, there's a crowd around them, and people start calling out, is there a doctor in the house? Is there a doctor? And they just stand around waiting for some medical professional to come forward. It's not necessary to do that. You're going to be doing the same thing that anybody else could do.
Correct. Particularly if the patient is not breathing and is not conscious, because at that point, there really is only one thing to do. But sometimes that's a difficult decision to make. You know, am I confident that this patient or this person is not breathing and is not conscious? But again, very simple things, just, looking to see if there's chest rise or listening to see if you can hear them breathing, shaking them to try to get them to respond. That's really all that's necessary.
Okay. Let's go on to some kits. I understand you brought in some kits today. You spoke a little bit about, I think, Prepper for a Day.
Sure.
Would you like to demonstrate that and what you have in your kit that you take along with you?
Sure. Moving on, in terms of what we should all have as basically just trying to help a neighbor. Certainly, learning CPR and AED training is very important, but also basic first aid is really important. So if you don't mind queuing up the next slide on Prepper for a Day, that has another scenario with a basic first aid type idea behind it. So in this case, you may be out hunting with a friend, and you have your 34-year-old friend. She is accidentally shot by another hunter. And she suffers a single wound to her thigh, and it's bleeding quite badly. And you and the other members of your hunting party are pretty remote. So, although again it's a disaster, it's beyond your ability to provide care, and your ability to get resources to help is limited because you're not in an environment where you can simply call 911 and an ambulance is going to show up, or at least not within a reasonable period of time. So some of the things that are important to carry with you are basic bandages, just to provide direct pressure. And there are certainly lots of commercial bandages that are available, but a very effective one is actually just a feminine hygiene pad. And they're made to be very absorbent, and you can put them over a wound, and then if in this case your friend who's injured, who's bleeding, put them over a wound and simply apply direct pressure. And that is key. Just simply taping it around the leg or whatnot would not suffice to stop the bleeding. You have to apply enough pressure that you can compress blood vessels and allow the bleeding to stop. There are certainly more advanced dressings than this. There are dressings that are made today that have compounds in them that are made out of either porous rock material or ground up shellfish shells. Mm-hmm. And what they do is absorb water and concentrate clotting factors, and they can stop even arterial bleeding. They're relatively inexpensive and can usually be found at a sportsman's store or at a pharmacy.
That's like the Quick Clot and the Celox.
Correct. Right. Quick Clot, Celox, HemeCon, there are a variety of different ones. They're all relatively effective. Again, some are made with materials like zeolite, which is essentially like a lava rock, which absorbs water and concentrates the factors. Others are made with chitin, which is a material that's made from shrimp shells.
Now, some of those are in a powder form, and other ones are actually embedded in the gauze itself, correct?
Right. Most of the ones that are sold today are embedded in the gauze themselves, and just because there's some risk of getting the powder into the wound that could cause problems with clotting and such. So the ones that are in the bandages tend to be better and much easier to use. Okay. Even those devices, though, require direct pressure. So as soon as you place that hemostatic dressing on, you want to go ahead and apply direct firm pressure over the wound as well to compress those blood vessels and stop the bleeding. Depending on how remote you were with your friend while you were out hunting or while you were in an austere environment, using a tourniquet is also an option. And tourniquets fell out of favor because there was concern that they would cause injury to blood vessels and you could lose legs and limbs and things like that. But they're really quite safe, particularly for relatively short periods of time, say less than 4 hours. Okay. And then the way they work is very simple. They're all relatively wide bands of nylon-type material with what's called a windlass or a winding band. And you would simply slip it over the leg to the area that above the area that was affected, the area that was bleeding, and you would wind the windlass, tighten it down, and wind the windlass in order to create pressure, and then the windlass would merely slip beneath this this little clip, allowing you to maintain the pressure and stop the bleeding. And again, these will stop bleeding and potentially save the person's life, but shouldn't be used for more than 4 hours at a time. So you really have to decide what resources you have available and how long it will take to get the person to definitive care.
Okay, so I see that it says time here. You're supposed to write the time, so that reminds you exactly when it was put on, and let the other people know what time it was put on. Now, what if you put it on and you're still waiting, 4 hours goes by? Do you take it off?
So in general, I would not recommend that. And at that point, the concern would be, are you putting the person at risk of losing their limb or losing their life by removing it? Okay. So that requires a little bit of thought at the time as to what resources you have available.
Okay.
But again, in terms of controlling hemorrhage, direct pressure with a good absorbent dressing, using a hemostatic agent, or in severe circumstances, using a tourniquet are pretty simple options that everyone can learn.
Okay. What else do you have in there?
So in many of your viewers who are self-reliant folks or preppers, they have a bag for evacuating, a bug-out bag. And the medical kit that I keep for that purpose is very, very simple. It's only a few dressings, some tape, things that would be useful to you if you were out exposed for a long period of time, like sunblock or insect repellent. Something that will allow you to clean your hands or clean a wound, like an alcohol-based gel. If you're treating just you or your family members, gloves are probably less important. Maintaining your cleanliness is important, certainly, cleaning your hands, but you're obviously less concerned about transmitting disease at that point.
So the concern is that you would contract something, not that you would be infecting the wound.
There's still possibility to infect the wound, so you definitely want to make sure that your hands are clean if you're treating your loved one or whatnot. But again, it all depends on what your resources are. If you have the ability to go to the CVS and get more gloves, great. But if you're in either a very remote or in an area, or if you're in a situation where you don't have access to other supplies, then it would be acceptable not to use gloves, but to make sure that your hands were clean.
Okay.
Certainly, a medication like ibuprofen or Motrin, something that would allow you to provide some pain relief, is important. Things like anti-diarrheal medications or anti-nausea medicines are important. A lighter, obviously, always useful to be able to have a tool to start fire, but also if you had to clean any instruments or something like that, it would serve use.
Now, I don't see any instruments here, so I assume that's for a more advanced kit.
Perhaps for a more advanced kit, but even if you had to remove a fish hook or a splinter, then your multi-tool is sufficient to do that.
Okay.
So, but again, you'd want to try to keep the multi-tool as clean as possible, and either dipping it in an alcohol-based solution and allowing it to dry. That's important. Or heating it might be helpful in order to try to prevent contamination. But certainly having a multi-tool and a flashlight, which most everyone should have anyway, are very useful things to have as part of that very limited kit that you would have for evacuation.
Okay, let's just dispel the myth right now that your average layman is going to be able to do surgery even in a remote area on someone.
Right, and we certainly wouldn't recommend that. trying to perform procedures or attempting skills that you're not trained to do is incredibly dangerous. What I would encourage you to do, though, is to try to get some training to the level that you feel you need. Certainly a good first aid course is a first step. And if it's something that you feel is important, then getting additional training, like taking an emergency medical technician course, which is usually available through most schools, community colleges, and relatively inexpensive, both in time and money. It's about a 120-hour course, and you can take one usually for a couple $100.
Watching the whole series of Grey's Anatomy does not certify.
No, not at all, not at all. Nor do episodes of ER. So
I'm wondering whether that phenomena that we have today of people watching these things on TV makes people feel like they're more capable of doing these types of procedures. And I mean, I don't know if there's been any studies done on, but I can imagine that people watch this on a daily basis, or that they would think that, you know, I could do that. That looks pretty easy to do.
Interestingly, there have been some studies looking at CPR and what people's attitudes towards CPR are, and you know, in the best circumstances, CPR will save 15% of people, but
it's pretty grim.
It is grim, and in most places in the United States, it's actually much less than that. It's probably on the order of about 5 to 7%. But as you can imagine from watching these television shows and whatnot, the impression, at least that I get, is that most people are revived immediately and do fine, which is not the case, unfortunately.
So the case that you spoke about, you're in a remote area, someone's been shot. Mm-hmm. And there isn't a medical facility around. Your recommendation would be just to use compression, to use some sort of bandage, you know, hold the compress on it and wait. Or I mean, at what point do you decide, you know, this thing's going to be infected? I don't know. Would you try to remove the bullet from this person's body?
No. So never try to remove the bullet or any type of impaled object, okay, because it could be. One, you're much more likely to introduce infection at that point, and say it's an impaled object like a piece of wood or something like that, you run the risk of disrupting blood vessels and worsening the bleeding. So
you bandage around the object.
Correct, and do what you can to stop the bleeding as opposed to trying to remove it. And then the question is, are you able to summon resources to you? So if you had a cell phone available, could you call for EMS? And maybe it would take a little longer to get there, perhaps an hour, but they would be able to come. Or are you going to have to extricate the patient or the person that you're with from the environment to somewhere where you can get help? So would you have to say, help that person with additional people by carrying them to a highway or someplace where you could summon additional resources? Or if you were alone, probably the best way to do it would be to take a rain poncho or coat or something like that, lay them on it and drag them out.
Now the concern, besides the bleeding, let's assume that the C-locks or whatever stop the bleeding. Mm-hmm. A concern for infection, do we want to clean the wound?
So, you know, not initially, and particularly considering that what you would have to clean the wound would be pretty limited. Perhaps maybe some alcohol or maybe some peroxide or something of that nature. I wouldn't put extensive effort into cleaning the wound. I would try to keep it clean free of debris. But then beyond that, just try to get the patient to definitive care.
And this patient's obviously in a lot of pain. Would you give them the ibuprofen or an aspirine if a person's been shot?
So if that's all you have, yes. But just a reminder is that all the anti-inflammatory medicines like ibuprofen, Motrin, aspirin can worsen bleeding. So among the over-the-counter pain relief medications, probably Tylenol is the best at that point.
Okay. So have we finished with the
yes.
prep of our day? Okay. So let's move on to the next kit.
Okay.
What do you have in the next kit?
Sure. So assuming that you've been assuming that you have you need going to be away from resources for a longer period of time, then you're going to need a bit more supplies. And this is a kit that contains materials that are primarily the same materials that would be recommended either by the American Red Cross or by the Centers for Disease Control. Both the U.S. government and the American Red Cross have wonderful resources in terms of disaster preparedness, focused primarily on someone who would need to be self-sufficient for about 3 to 7 days. Okay. And the reason that that time period is chosen is because that time period, if there was a catastrophe in your region and your city's resources, your local resources were depleted, it would take about that long, about 3 to 7 days, for there to be a federal response. So if we think back to disasters like Katrina or Superstorm Sandy, while the local EMS, the local fire department, the local phone lines are all disrupted, it's going to take at best 3 to 7 days for a federal response to move in the National Guard and disaster assistance teams and things like that. Because again, they're coming from all over the country, and to mobilize those resources is quite difficult, particularly when there's no infrastructure. So in order to be self-reliant, what do we need to take care of our family during that 3 to 7 days? It's fairly basic equipment. This is, again, more or less what's recommended. It includes the same things that would be in that Prepper for a Day kit, the lighter, the antimicrobial alcohol-based hand wash, simple tools like a multi-tool or a flashlight. But it would also include things like tools to help prevent infection, particularly if the disaster was a communicable disease. So in 1918, we had 18 million people who died from influenza in the U.S. Although there are vaccines and medications to help mitigate that, really the most effective way to prevent from getting an infectious disease like influenza is having proper attire, using gloves if you're touching someone, having a mask to prevent from inhaling a pathogen, and making sure that you wash your hands after contact with somebody. Or contact with a public space, like a bus railing or something of that nature. The masks can be gotten at any hardware store or drugstore. It's important to look for masks that are labeled as N95, or essentially that will filter 95% of particulate matter, because those are most effective at reducing the risk of infection or inhaling some type of noxious thing. In addition, again, having those types of items that will prevent you from suffering other ills, like having an insect repellent or something, particularly if you're going to be outdoors, is important. Having some type of light source is important, so a flashlight or a little sticky light is very useful as well. Having products to clean wounds in the skin, which can be as simple as a wet nap or baby wipes, are also useful. Again, lots of dressings, a variety of sizes, the highly absorbent dressings, Band-Aids, sterile pads. All these are useful for dressing small wounds. Some tape is useful. Cloth medical tape is probably the easiest to work with and one of my preferences. But as with anything else in life, you can fix it with duct tape as well. So,
Prepper resource number one.
Exactly. Very, very little in preparedness that can't be fixed with duct tape. Cold packs, chemical ice packs are useful to have. They're a little bit heavy, particularly if you have to carry them, but and obviously they're a one-time use resource. But particularly for providing analgesia to a family member who's injured a limb or something like that. They're very useful, and they can also be useful for other things too, like heat illness and whatnot, which we'll talk a bit later. Little odds and ends which may not be thought of, may not be particularly thought of as particularly important, but can make a big difference. Certainly having things like tweezers are often recommended by these kits for pulling out splinters and things like that. And again, important to clean the edges with alcohol or something prior to using them. A thermometer is very important. This happens to be a digital thermometer. If you can find them, I would highly recommend using an alcohol-based thermometer. Reason being that you never have to worry about the battery dying,
Right.
Which is certainly a problem.
Are you talking about the old mercury?
No. So the mercury ones are silver. The alcohol ones have usually a red liquid inside them, and obviously they're safer than having the mercury around if you break them. So they're kind of my preference.
Now, what do you think about the other thermometers that are out there? Just quickly, ones that go on the forehead or in the ear.
So the skin temperature thermometers are generally pretty good. They're not very precise, but they don't need to be, because essentially, if you just want to know if your child's has a fever, they'll do the job. The tympanic thermometers I'm a little leery of, because they're very, very accurate if you know how to use them, and they do have a little bit of a peculiarity that you have to get them precisely aligned in the ear for them to work properly. So I generally don't recommend them for someone who's not had experience or training with them.
Okay.
Comfort items like lip balm, particularly if you're going to be outdoors for a long period of time, going alongside with the insect repellent and the sunscreen can be very, very important, because certainly you can suffer pretty debilitating injuries from environmental exposure if you're not used to it. Very simple items that you may not normally think of, but are very useful, are a sewing kit, not necessarily for sewing wounds, although with some training that could be useful as well, but also for making repairs to dressings and clothing, which is important in terms of keeping the environment out and being able to protect yourself from the elements.
What do you think on that line of thought about emergency blankets? Those silver blankets that wrap up.
Absolutely. So a Mylar blanket is a great idea to keep. That's actually something that I keep in my evacuation bag. Is a Mylar blanket. Other neat, very simple things to have are a medicine dropper. Certainly important if you have children, but also important if you choose to clean your water with bleach. Very simple and very inexpensive way to clean water that may or may not be contaminated is simply to filter it through coffee filters or something of the like, and then just drop 16 drops of bleach to a gallon of water. And so certainly a medicine dropper is a really key piece of equipment. Cyanoacrylate glues, so a crazy glue, for instance, is actually a great way to bond a small cut on the arm or on the leg. It works very well.
Are they not toxic?
They can cause some local skin irritation, but we use fancier sterilized versions in the hospital all the time. The couple of warnings with them obviously are that one, it's very important to clean the wound very well, because they'll trap any bacteria or whatnot in the wound. And if the wound is under a lot of tension, they're not useful. But for small lacerations and whatnot, it can be a very powerful way to keep the wound clean and closed.
Just regular over-the-counter super glue.
Yeah. Let's see. That encompasses most of the things in the kit. I keep a separate portion of that kit, which is all medication. And the medications I'll discuss are over the counter. There are a couple of other really useful things like anti-emetic medications or nausea medicines that are very useful, but because they require a prescription, that's really a conversation that you would have to have with your doctor to decide if that's something that you would feel comfortable and they would feel comfortable with you keeping a supply of. But really basic stuff, aspirin, truly the wonder drug as they claim. It's a wonderful analgesic. It is wonderful for pain. It's wonderful for suppressing fevers. And because it does prevent platelets from sticking to each other, if someone has a heart problem, it is the first line agent. Again, if you have no access to medical care, it doesn't really matter if you give an aspirin to somebody with a heart attack, but certainly if you are able to get somebody evacuated to care, this is a great thing to have on hand. Antibiotic ointments are helpful. Hydrocortisone creams for insect bites, itching, that type of thing. Benadryl or diphenhydramine, I apologize for using the brand name, but any of these antihistamine drugs are very, very powerful for a variety of reasons. They can be used obviously for allergic reactions and the like, but they can also help with sleep and those types of things, although they have to be used properly to do that. Contact solution or eye wash can be really important too in case you've gotten foreign material in your eyes and want to be able to irrigate them out cleanly. Anti-diarrheal medicines, over-the-counter, again, loperamide is one of them, which is very effective and safe and relatively inexpensive. And acid medications like ranitidine, which is over-the-counter, things like Zantac or Tagamet, that type of thing, can be useful. Cough medicine, again, for comfort, particularly if you're going to be trying to provide your family with some relief and you don't have access to medical care. All those things are very useful.
Okay.
Do you have any questions?
No, let's move on to, do you have other slides to cover?
Sure.
We have some short,
So
only a few minutes left. So
Sure, just to go through a couple of those last slides. So if you were in that superstorm, as we discussed earlier, and you've been sheltering in place, you're unable to call for EMS or you're unable to get to the hospital, and one of your loved ones has fallen ill because they've been drinking contaminated water. Again, obviously, the first thing is prevention. Is making sure that you're able to clean the tap water. Commercial filters are great, but obviously they wear out and have to be replaced and monitored. Using things like homemade things like coffee filters and bleach are a reasonable substitute, although certainly not perfect. But if someone does contract an illness from being exposed to contaminated water or food, really the key thing is trying to replace the fluids that they lose through diarrhea and vomiting and such. So if you have an antiemetic, an anti-nausea medicine, then giving that is obviously going to be very helpful. But a very simple thing to keep somebody rehydrated is to make rehydration solution. And this is what is used in the third world. It's a recipe that's put forth by the World Health Organization, and it's really simple to make. It is 2 tablespoons of table sugar and half a teaspoon of salt to a liter of clean water. That will help to keep the patient rehydrated, to help, the salt will help hold on to the fluid, the sugar will help them absorb the water better, basically you're going to have to make a guesstimate of how much fluid your loved one has lost due to the diarrhea or vomiting or things like that, and then replace that 1-for-1 with the oral rehydration solution. And obviously these are things that you would have in your stores at home to make a rehydration solution. If we go to the next case, we talked briefly about a friend who is maybe out trying to cut some firewood for fuel, and it's a hot day, it's very humid, and they come back and their skin is very warm, they're flushed, perhaps they're confused, and their heart rate is very high. This is a concern when you're out in the elements and you're doing very hard work. Could the person develop a heat-related illness? In this case, because the patient's confused, they have altered mental status, that's heat stroke, the most serious form of heat-related illness. And it's very important that the treatment is simple. It's to try to cool the patient, to get them out of the sun, to get them into a cool environment, to remove any clothing that they may have on them, to try to cover them with a mist of water or with a little bit of water from a canteen, because the water will evaporate and that will absorb a lot of the heat and take it away from the body. Fanning them, if possible, can accelerate that a little bit.
With that, we're going to have to close it up.
No
I know there's so much to speak about, and I'd love to have you back because there is so much more that we could discuss. But I wanted to thank everybody for joining us today. I wanted to thank our guest, Dr. Gayet. There's so much information. There's so much more to learn. I definitely recommend that people go out and take courses. Definitely, in addition to this, if you have a first aid manual, because I'm sure we all don't know what you know, that would be great as well. Any questions, people are welcome to contact us, and I can definitely forward on if there's questions for the doctor. And like I said, thank you for joining us at the Prepper Report, and we hope to see you next time.
Thanks for having me.
Thank you.